Computer. All righty, we are here. Hi, everyone. I'm Dr. Funke Afolabi Brown. I'm the founder of Restful Sleep MD. And as you know, I'm always excited to bring incredible guests here to talk about science, to talk about sleep in one shape or form or the other. I'm so excited to have the honor of having Dr. Joseph Dzeirzewski here, who will be speaking to us on sleep and mental health. May was because you're probably going to be listening to this after May, but May was the Sleep Awareness Month. So I think this is just such a critical topic. And who better to speak to us? You will know why I'm saying so in a moment. So it's so good to have you here. Joe, how's it going? Can you introduce yourself to our people?
Yeah, well, first, thank you so much for having me and letting me come and represent National Sleep Foundation and the work we do. But as you mentioned, my name is Joe Dzeirzewski. I am the Vice President of Research and Scientific Affairs at the National Sleep Foundation. Prior to beginning this journey at the National Sleep Foundation, I was a tenured associate professor at Virginia Commonwealth University, where I was the director of our behavioral medicine concentration. I'm a licensed clinical psychologist by training with background and expertise in behavioral sleep medicine and clinical geropsychology. And I come to NSF and VCU through routes of University of Florida for graduate work, UCLA for my first job, and wound up where I am today.
That's incredible. You're making this sound really, I can tell you're very humble, but that is amazing. So what prompted you to decide that sleep was it for you? What was that like? And how did you come to that realization?
It's one of these things where I'm sure in medicine it's the same thing, right? There's a certain point in your training where you just have to make a decision. You have to all of a sudden decide that you're going to specialize in something. And it was actually really early on in my training, actually before I started even graduate school. I know that I always wanted to do something with older adults because I think they're super underserved and underrepresented, but I also wanted to do something that would allow me wide breadth and the opportunity to help and communicate with a lot of people. And I was completely unaware of sleep as an undergraduate. I started looking at different programs and I saw one potential mentor who listed that they study and investigate sleep. And this light bulb went off and I said, sleep? We all do that. It has to be important. When I don't sleep well, I don't feel good. I applied to work with that mentor and was fortunate enough to go to the University of Florida and be able to do this work and never look back. Once you get into the sleep field, you just realize how important it is, but also how fascinating it is and how much we still have to learn. And you just, it kind of snowballs on itself.
That's amazing. And I could just tell your eyes are lighting up. And before we hit record, I was just talking about the fact that I'm away at a conference where I spoke on sleep disordered breathing in sickle cell disease and just the energy in the room and how people want to understand science so they could do better and they could take the care to the patients. And just like you said, there's still so much that's unknown and everybody sleeps, right?
Yeah. I mean, you hear it oftentimes, and I'm sure you've heard this before, but it's the saying something like, if sleep doesn't serve a vital function, it's the biggest evolutionary mistake ever, right? We spend a third of our lives doing it. It has to touch everything. It has to be important.
Yep. That is so true. We do spend a third of our lives sleeping. And I just think it's incredible that you are at the National Sleep Foundation. Now, for those who may not know what this is, a lot of my audience are busy, high achieving, professional women. Some are doctors, several are not, some are parents, some are, just people from all walks of life. So can you tell us a little bit about the National Sleep Foundation and then the Sleep in America poll, which is really what we're going to be talking about today? What is that all about?
Yeah, of course, I'd be happy to. So the National Sleep Foundation is a nonprofit organization with a mission to help improve health and well-being through sleep education and advocacy. So it's a very simple mission, very important mission, and it's been a long-lasting mission, something that we've been dedicated to for over 30 years now. Our general promise to the public is to help anyone and everyone be their best step self. So again, with this focus on equity and inclusion, really just trying to raise awareness and help people achieve the lives that we all deserve through sleep.
Incredible. I did not know it's been around for over 30 years. That is amazing.
Yeah.
That is really amazing. So how does the poll come about, the annual poll? Because I use that data all the time. And it's interesting. That's how I met you.
Yes. Yeah.
And we're talking about how small this world is, because when I do give talks, I'm like, I need the data from National Sleep Foundation, because it samples, you tell us what it does. I don't ruin it.
Yeah. No, definitely. So the Sleep in America poll is really, like you're saying, it's the premier annual public review of our attitudes and behaviors around sleep. And every year we focus on a different topic, a different thing connected to sleep. Let's say it could be pain or women in sleep or what have you. So each year it changes, but it's really what sets it apart is, number one, it's got this really important, timely, topical focus every year that changes. But number two, it's good, high quality survey research. It's probability based, and I could go into why that's important. It's representative of the whole nation, and I could say why that's important. And we use validated questions. We come up with it through working with sleep experts, but also polling experts. So it really provides us this snapshot that we update annually on how people are sleeping, what do we think about sleep, and how sleep's related to an important topic. So it's really provides very, very nice information for the nation, but and for everyone to use.
Yeah, and it's definitely been so helpful and so eye-opening. So now we talked about May being Mental Health Awareness Month, and I just thought it was perfect to have you just really walk us through some of the data. So first of all, why was mental health and sleep, why was that the topic for this year? And then maybe you could give us sort of like a bird's eye view of what the findings were.
Yeah, so two-part question, right? So why do we focus on mental health? Well, this past year, in March, when we released the data, that's Sleep Awareness Week, this was our 25th anniversary of Sleep Awareness Week. So it was a big deal for us. I'm not sure what the 25th anniversary is. Is it gold, silver, platinum? It's something though, right? It's a big one. So we wanted to make sure that our poll focused on something that was timely, impactful, and really touched on how important sleep is. So we decided at that moment, after thinking about a bunch of different ideas, let's focus on the link between sleep health and mental health. Right? It's just such a compelling story there, and it's so important. And the timing's right. When you have, people like the U.S. Surgeon General, you have NIH, CDC, all these people talking about how the U.S. is in the midst of a mental health crisis, right? So let's think about sleep, and let's think about how sleep maybe relates. So we really did, and we drilled it down further for mental health. We spoke about sleep and depression and depressive symptoms. And again, for the whole general U.S. adult population as a whole. And what we found, to me at least, was very, very compelling. So we'll start on a little bit of a positive note, because I like to think of myself as a positive person, right? So the very first thing we saw was that 90% of adults with good sleep health also reported being free of any significant levels of depressive symptoms. So people with good sleep health didn't have very many depression symptoms. However, the other side of that coin was very striking. Nearly 7 out of every 10 adults who simply checked off a box and said that they were dissatisfied with their sleep. So are you satisfied with your sleep? Yes or no? If you said no to that, 70% of those people had mild or greater levels of depressive symptoms. 70%, that's a huge number for just the general US population. We also saw that people who had difficulty falling asleep or staying asleep just 2 nights a week. So not every night, not 4 or 5, 2 nights a week. They had more levels of depression symptoms than people who had, 0 or 1 night's difficulty falling asleep or staying asleep. And we saw that half of all people who slept less than the National Sleep Foundation recommended 7 to 9 hours per night, that's your good, healthy amount of sleep, also had mild or greater levels of depressive symptoms. So there was this really strong and compelling relationship between how we're sleeping and how we're feeling during the day.
Yeah, yeah. I mean, this is just was that because that was I knew really even going into this data that it was going to reflect that bi-directional relationship
Mhm.
between sleep and mood. But wow,
Yeah,
really, and to think that this was not a referred population. This is the general, like my neighbors, like the people in the community, right? So did that surprise you? And then what do you think was driving this, right? I know it's a poll, like
yeah,
time, just one time
yeah.
poll. So we can't necessarily say one is causing the other, but what were your thoughts from that?
Yeah, no, those are excellent questions, Funke. And I will start with saying that it did surprise me. And for the reason that you said,
Mm,
right? There's a long-standing history of this relationship between sleep and
yeah,
depression. But these are from people who are
mm,
recruited because they have insomnia, or maybe they have
yeah,
sleep apnea, or they're recruited because they have major depressive disorder, right? These are clinical
mm,
populations or populations self, identifying. But in our poll, it was the general US adult population. Like you said, our neighbors, our brothers, our coworkers. So when I was digging into the data and finding some of these things, this is something I actually don't share very often. But when these numbers 7 out of 10 popped up, I was actually like, I'm starting to get choked up a little bit because I was like, this is everyone. This is
no,
touching
no,
everyone. And it really
mm,
speaks to how important these things are. Not only how important, but how widespread, right? How just completely widespread we are. When we're talking about a mental health epidemic and pandemic, we're also talking about a sleep health epidemic and pandemic. And
mm,
those things a lot of times we don't actually connect, but it's true and it's there and it's people's lived experiences. Now,
yeah,
why are they related? I don't know. The chicken or the egg, which one comes first?
yeah,
It's an important question. It is. But I know at the end of the day, both chickens and eggs are both important, right? So from a clinical perspective, from a compelling, just personal lived experience, I think it's less important which one comes first. Theoretical, conceptual, maybe treatment, delivery, and
mm,
development. There's a lot of nuances
mm,
there. But I mean, you could see it as a two-way road. You could see when you have a poor night's sleep, just how do you feel the next day? You have less energy, less reserve,
mm, mm,
less likely to maybe interpret positive events and maybe more likely
mhm,
to interpret those negatives, right?
mm,
And when you sleep poorly, what are you doing? You're gonna maybe lay in bed for extra long to try to make up. You might
mhm,
not get outside and get exposure to bright light. You might do all those things that we
mm,
know are also related to worse mood. So it's certainly like this
yeah,
reciprocal vicious cycle that you could just feed on itself.
mm, mm, that is so true, and I think I love that idea of the fact that whether it's the chicken that came first or the egg that came first, we need to address both, right?
Yep. And
That's the bottom line.
they're both important, chickens and eggs. You
Yeah,
can't,
yeah, they are.
you got to talk about both of them.
Yeah, yeah.
Yeah.
So then where do we go from here? Where do we go? What next? How do we address this, right?
Yeah, that's the $1 million question. And the nice thing,
Mm,
this is going to be, me patting the NSF on the back. I think we did a great thing is we didn't just stop when we asked about sleep and we asked about mental health. We
mm,
also asked about what we call healthy sleep behaviors. So we
mm,
recommend a whole different line of healthy sleep behaviors. But when we asked people,
mm,
how frequently do you engage in these behaviors? We saw that
mm,
adults who engage in high levels of healthy sleep behaviors also reported being free of significant depressive symptoms. So it wasn't just good sleep, but it was also, these behaviors that we are pretty sure are related to healthy sleep are also related to lower rates of depressive symptoms.
mm,
So there is a little bit of a light at the end of the tunnel. There's a there's a signal, if you will, a signal that perhaps doing things like getting exposure to bright light in the morning, getting some physical activity several days a week, eating your meals at consistent times, avoiding nicotine, alcohol, caffeine before bed, engaging in a nice, relaxing bedtime wind down routine, allowing 7 to 9 hours. The thing is, if you don't allow for 7 to 9, if you don't give yourself a window, you're not going to get it. And having that cool, quiet, dark, comfortable sleep environment. People who do those things regularly, not only are they sleeping better, but they're having better moods. So, there's some ideas. Again, like you said, this data's, this snapshot one time and one time, one space. We can't really say what came first. But again, we know people who are doing healthy sleep behaviors also have better mood. So perhaps there is this, hey, what can you do? Engage in these healthy sleep practices. Be consistent with them. Give them a fair shot. Try to improve your sleep health and see if this is one of those rare situations in life where you can two birds, one stone, where you can get multiple benefits out of improving and targeting one thing.
That is all just so powerful. I love the fact that give yourself an allowance of 7 to 9 hours, because if you're aiming for 7 hours of sleep, but you're going to bed at the 7-hour mark, then you're not going to get 7 hours of sleep because you need time to wind down, you need time to think. So really creating that buffer, I think, is really important. And in addition to everything you said, and while I think especially since the population we're talking about is the general population, of course, there will be cohorts, there will be group of people who have underlying sleep disorders where they'll need that extra. But we're talking about, let's even get the basics right? This is low-hanging fruit. Let's work on that and then take it to the next step. I don't know what your thoughts are about that, because a person who's like anxious and depressed may be like, wait, don't talk to me about healthy sleep habits. I need this fixed. But this is an incredible place to start.
Yeah, so I think you're speaking to something that's very important, and it's an important distinction, right? These healthy sleep behaviors might not be a cure-all for people who have diagnosed insomnia and, clinical sleep disorders. And I don't want my colleagues out there in behavioral sleep medicine to be like, oh, Joe's out there talking about sleep hygiene, and he knows that this stuff doesn't work for people with insomnia. That's true. But here, I'm going to use a very interesting analogy or metaphor, if you will. If I have a nice minivan and it does the job and it gets me from A to B, but I want to get to A to B faster, I might think in my head like, ooh, maybe I can put some racing fuel in there, right? That would be like doing cognitive behavior therapy for insomnia on the general population. The general population probably doesn't need the racing fuel. You might think you're doing good, but if you put racing fuel in a minivan, you're probably going to break it, right? Put the gas that belongs in there. Give it the sleep recommendations and tips that are made for those for that minivan, right? You don't have to overdo it, but you also don't have to undersell it. It's really about meeting people where they are.
Yes, and yes to all of that, because that's also something that I'm really passionate about. Because obstructive sleep apnea is underdiagnosed, yes. But the prevalence is not 80%.
Yes.
Insomnia's prevalence is high, we understand that. But there are more people who are struggling with issues related to just sleep opportunity, inadequate sleep hygiene. And when we think about just this data, it's important that we deal with this as sort of the fundamental piece, knowing that, yes, there will be people that will need a lot more, like you said, cognitive behavioral therapy and other therapies. But now we're saying, where do we start? And this is an excellent place to start. And there's evidence to show that it helps. Again, not to treat, not as a definitive treatment, but even for people that have other underlying sleep disorders, having healthy sleep habits is very, very critical to whatever therapies that you're going to use.
And you could even say it the other way, right? Prioritizing your sleep, having a healthy wind down routine was never a bad thing for anyone.
No.
Right? No. If it's going to do something, it's going to help. It's not going to harm. And like you said, it's a good place to start. It's almost like those public health campaigns of, suggesting people quit smoking. That's probably not enough for people who, have a lot of dependence, psychological or physical, on the nicotine. But for some people, it might. And the message can reach so many people that you're having broad, big impact on society.
Yeah, yep. I really like your analogies. They're excellent.
Thank you.
Yeah. So this has been of tremendous value, and I know that this is going to help a lot of women in my community, a lot of families, honestly. Now, in terms of if people they've done this, what would you suggest, right? Like as a sleep expert who is a psychologist, how would we move forward? Like, should they seek professional help? And at what point would you say, okay, this is not something you should handle alone? I just want us to put that out there, especially since we're talking about a very sensitive topic.
Yes, definitely. So I think there's, the two angles. From a sleep perspective, when should you seek professional help and from whom? And from a mental health perspective, when should you and from whom? And those might be different things, depending on the gravity of the situation. I think from a sleep perspective, if you've tried common sleep recommendations, the things that the National Sleep Foundation recommends in our Best Slept Self framework, consistently and given it a good effort. Consistency is key when you're trying to change behavior, right? Did you really implement these things on a consistent basis? And are you struggling during the day? Are you having a hard time with your daytime functioning? Has it lasted several months? That's a point when perhaps you want to go in and speak to a sleep specialist, whether it's a clinical psychologist or physician, someone who has a background and training in sleep. From a mental health perspective, I think anytime you start thinking about self-harm, that's a telltale sign that you should be going and speaking to someone. And luckily, there are great resources out there. There are hotlines specifically dedicated for people who are having thoughts of self-harm. But anytime that your mood dips below, those common blues, anytime that it's impacting your ability to interact with loved ones or get your job done, fulfill your requirements and your needs, these are points when I think we all have to step back and prioritize ourselves. And it's a point where we have to be selfish for ourselves, because really you're not helping anyone around you either by not helping yourself. So do what it takes. Call the hotline. Go talk to someone. There are so many providers out there, starting even just with your primary care physician, right? They oftentimes hand you a questionnaire every time you go in now to ask about your mood. And that's a great place and a great starting point for you to have a conversation and say, you know what, doc, I know you gave me this questionnaire. Can we talk a little bit more about this?
Yeah, that is true. And let's be advocates and also be aware of those symptoms, and to know that there's help out there. You don't have to struggle, especially when you really realize that low mood is becoming more pervasive. And this has been amazing. What would be some final thoughts? That's one. Resources and where people can learn more about the National Sleep Foundation and the work you do, just to really move us on to the next level, because we don't want to bring this data out and be like, okay, see ya, good luck. But like, I know this will help people connect the dots.
Yeah. So kind of final thoughts, the place where I land, the more and more that I'm thinking about sleep from a public health perspective, I think one of the things, like I just mentioned, prioritize yourself, but prioritize your sleep. Yeah. When you prioritize your sleep, you are prioritizing yourself. You're prioritizing your job, your loved ones, your productivity, your mental health. You're prioritizing all of those things by prioritizing your sleep. Think about sleep like that. It's really a thread that connects our mental, physical, and social lives. It does so much for us. Think about it that way and give it its due respect. Prioritize your sleep. Do that. And then, of course, everyone who's watching, visit us online. We have a wonderful website, lots of resources at the NSF.org. So the NSF for National Sleep Foundation.org. Lots of great information there. We have our whole best slept self framework that lays out those 3 daytime tips, 3 nighttime tips to help everyone be their best slept self, along with just a lot of other really, really great information. We release our results of our polls to the public every year. We have 2 big public facing campaigns: Drowsy Driving Prevention Week in November of every year. This is when, sleep health and public health really intersect. And we have Sleep Awareness Week every March, where we just aim to raise awareness around important issues surrounding sleep, thoughts, attitudes, behaviors, special populations, a whole different thing. But it's not just twice a year. We have information all the time. So look us up online, and we'd love to hear from people.
Yes, yes. And I would definitely echo that. That website, bnsf.org, and I'm going to put that link in the notes as well, has been a great resource, even for me as a clinician, for me as a coach, because I also coach moms on sleep habits and how to get better sleep. So it has helped me. Trust me, it will help you. So go right there. I'm going to put the link in the notes, and definitely reach out if you notice you're struggling with this sleep thing. I'm here to help. Because we know that sleep health and mental health is just so interconnected, and we want you to be, like your best slept self. And I think that is so critical. So thank you again for being here. It was so nice talking to you. I knew this was going to be a good conversation, and I would recommend, if you've listened to this, like it, comment, let me know how it connects with you, and share it with someone in your community, because the more we get this word out, the better we're going to help our world. Until next time, rest well.
Thank you all. Bye.
Bye.